Thank you all for joining. My name is Andrei Kamenzuli and I'm the clinic manager. I'm also a nurse by profession and I will be explaining a presentation of ways and means how you can remove your glasses. We're going to discuss what do you expect before these type of operations, what happens during the operations, contraindications, who can't go ahead with these type of surgeries, and complications that we encountered during the past 28 years we've been doing these types of procedures. In this clinic, we have a femto laser installed. A femto laser is the most advanced technology used nowadays to remove glasses. It's from Carl Zeiss, it's a German brand, and it has been installed in this clinic for the past 3 years. The advantage of this machine is that the patient will not experience any pain both during and after surgery. As well, we expect a very quick visual recovery, so the patient will restore his vision from the following day. I will explain some anatomy of the eye so you will understand better what I will be explaining later on. The eye is divided into two parts. There's the anterior part, which is composed of two lenses. There's the cornea and there's another lens at the back of the iris. This lens will help to focus and defocus, and at the back of the eye we have the retina, which is composed of an optic nerve and a macula that they are connected to the brain to interpret the vision that we'll be seeing in front of us. Most of the procedures that we perform, laser procedures, are performed on the cornea and implants are performed at the back of the iris. Either we remove the natural crystalline lens and we replace it with a multifocal implant. Nowadays we have also the option to use an ICL lens that is implanted on top of the other lens, so it's like a top-up lens to correct high myopia. Refractive problems that we encounter, the most common refractive problem is myopia. What happens is that with development the eye will get longer and the focal point of the natural lenses is focused in front of your retina instead of the retina. What happens with the procedures that we do will just displace the image to the retina so you'll be able to see clearly. Another issue is hyperopia. Hyperopia is the opposite way around of myopia. Instead of having a big eye, in this case you have a small eye. And the focal point will be weak, so the focal point will be at the back of the retina. In these cases, you would need a plus prescription to move the image on your retina to enable you to see better. Up to some time ago, we were not able to correct this type of refraction. But nowadays, with the help of the new technology that we have installed in this clinic, we are able to correct the plus correction with very good results. We also correct astigmatism. Astigmatism is related to the shape of the cornea. Instead of the cornea being roundish, most of the time we see that the cornea is a little bit more ovalish. And with laser and with implants, this can be corrected as well. Presbyopia is related to age, when we start losing accommodation of our crystalline lens. So instead of focusing close, we can't focus close anymore, but we would need reading glasses to help us to correct that. Nowadays we have two solutions how to correct this problem. We can correct it with laser by using the Presbyont laser blended vision correction. We correct the dominant eye for far and the non-dominant eye will correct it for close. The brain, which is the processor, then will analyze this type of vision and you'll see clearly both far and close. If a patient is not eligible to go ahead with this type of procedure, we have another procedure which is refractive lens exchange. What we do in this procedure is that we change the natural crystalline lens of the eye and we implant a multifocal implant lens. This gives more stability to your vision without changing, and as well this will prevent you from having cataracts later on in your life because we're going to remove the natural lens. Vision corrections, this is just a baseline of our corrections. It's the pre-tests that we do that will determine whether you're eligible or not to go ahead with this procedure, but this is just a baseline for you to understand. So myopia with laser we can correct up to -10, and with the ICL implant we can correct up to -25. Hyperopia we can correct up to +5 and astigmatism from -to +3. Reading glasses depends on the tolerance of the patient. There are three types of laser procedures that are performed in this clinic. We have the surface ablation procedure. This is classified as the old procedure. Surface ablation procedure used to be performed for 28 years at St. James Lima. Nowadays, we don't perform this procedure anymore. We opt to go for femto-LASIK and SMILE because this is better technology and is giving better results. So with the surface ablation procedure, we used to scrape the front layer of the cornea, which is called the epithelium, apply laser, and then we wait for this epithelium to regenerate, to grow up again. This used to take time and it was a painful procedure. Nowadays we're performing femto-LASIK and SMILE. In case of femto-LASIK, what happens with the femto-laser technology, we'll create air bubbles in your cornea. We create like a layer of air bubbles. We'll create a flap, we'll lift the flap, perform laser, and put the flap back in place. There is no pain in this procedure for the reason that where the femtoplane is performed, there's no corneal nerves, so the patient will not be in pain. With this type of procedure, we expect that there will be no pain and that the following day you'll be seeing clear as you used to see the day before with your glasses on. Then there's SMILE. SMILE stands for Small Incision Lenticular Extraction. This is the laparoscopic way of performing eye surgery nowadays. So instead of creating a flap, the laser will cut a tiny lenticule from your cornea. This is about 60 to 80 microns, and there will be a small cut on the surface of the cornea where the surgeon will just remove the lenticule that was prepared before with the laser. There is no pain in this procedure and recovery is very fast as well. The next step after this presentation is to book you for your tests. If you wear your contact lenses, you have to stop wearing your contact lenses for 7 days. And if you wear hard contact lenses, you have to stop wearing them for 30 days. The reason is that when you wear your contact lenses, you change the natural shape of your cornea. So the results that we'll be getting from our machines won't be realistic and they won't be the natural shape of your eye. This test would take approximately from 1.5 hours to 2 hours here in clinic. We will start by giving you some questionnaires that you have to fill up. Then you will be seen by our nurses. You will go through our diagnostic equipment. Then an optometrist will have a consultation with you where you discuss the diagnostic tests performed before, and he'll do several other tests. One of the tests involves the optometrist to dilate your pupils by applying some dilating drops. Because of these dilating drops, you will be seeing very blurry for about 4 to 6 hours. So we suggest that someone will drive you back home after these tests. We dilate the pupil, so we will be able to have a look on your retina and check that everything is fine at the back of the eye. We suggest that for these tests you get sunglasses with you to prevent a lot of light to go into your eye because it will bother you, but no harm will be done. Also, we suggest that you'll get your latest prescription. If you don't have the latest prescription, you can get your glasses with you and we can check the refraction from your glasses. After these tests, the next appointment would be with the consultant of your choice. You choose your surgeon and you go to this surgeon for an appointment with your file. You will discuss together what type of procedure would be best for you. So don't worry, that will be guided from our surgeons. We book the day of surgery when your surgeon will be operating, and we'll phone you the day before to tell you what time you would need to be here. We'll phone you the day before for the reason not to leave you waiting for a long time in clinic. After the consultation with the doctor, we'll give you a package of information and also we'll give you a consent form. A consent form is a legal document that you have to sign before every type of surgery, and we suggest that you read it at home at your leisure, and please come back to us with your questions. On the day of surgery, we'll give you some drops to apply, we'll give you an antibiotic, we'll give you a steroid, and we also give you a lubricant to keep your eyes moist as much as possible. Come wearing comfortable clothes. You will be lying flat and the temperature in the operating theater is quite cold, so even if you come to do surgery in summertime, we suggest that you'll get a light jacket with you. It's very important that the jacket won't have a hood at the back because this would increase the risk of movement. No perfumes and no aftershaves because alcohol might interact with the fluency of the machine, with the strength of the laser beam, and of course no eye makeup. It's very important not to apply mascara, and we suggest that you remove your mascara a day before, because sometimes it remains stained on your eyelashes and this would put you in more risk for an inflammation or infection. What is expected from you as a patient during this procedure is very important not to move your head or any part of your body. Each movement that you'll make will see a big shift under the microscope, so it's very important to keep still and not move. You will see a green light. You have to keep on focusing on the green light all the time, and at some point during the laser procedure this green light will get very blurry. You have to keep on looking to the same direction as when we started the surgery. If we talk to you during the procedure, don't answer us back or nod, because of course you move. So just listen to what we're telling you and just obey. Keep calm as much as possible. We know that you won't be calm, but we will do our best to keep you calm as much as possible. We will be instructing you all the time throughout this process. The procedure time depends on the type of procedures that we're going to perform. Laser procedures take between 10 to 15 minutes, and implants would take between 15 to 20 minutes on each eye. During the laser procedure, we don't expect you to stay still for 10 to 15 minutes, but we would need you to cooperate with us for 21 seconds, where the laser will be performing the cuts. It's very important not to move at this particular time, because there will be a complication that we would need to stop the operation. There will be no issue done to the eye, but we would need to repeat the surgery on a different date. That would be an extra hassle for you as a patient. You will not experience any pain during the procedure, and we just use anesthetic drops. We will not use any blades or needles. After smile surgery, we don't cover the eye for the reason that there will be no flap and nothing can move. In case of femtolasic and implants, we apply 2 transparent eye shields in front of the eye. You have to sleep for the first night with these eye shields. So this will prevent you to rub your eyes. The following day you have to come back to the clinic. We remove the caps for you and we'll start the drops. You can go home immediately after these procedures. You don't need to stay here to recover. It's a walk-in, walk-out procedure, and it's a very fast process. When you go home, you will feel some mild discomfort. You'll feel like your eyes are swollen, they will be very watery, and some patients explain it as the feeling that they have when they sleep with their contact lenses on, or they feel like a foreign body sensation going around their eye. The following morning you would need the first post-op consultation with your doctor, and then we would need to see you again after 4 weeks. If need be, we would see you more than 2 times as well. You'll be very sensitive to light, so we suggest that you'll get sunglasses with you the following day after surgery as well. It's very important not to rub your eyes in case of femtolasic and implants for at least 4 weeks, for the reason that you might move the flap or move the implant. These issues are very rare, but we try to prevent them by not rubbing your eyes for 4 weeks. In case of smile, you can rub your eyes after 3 days, that should be fine. Avoid dirty environments and direct contact with pets. If you have any pets at home, you can keep them, but very important, if you touch your pet, don't touch your eye afterwards, because this might create risk of infections. Contact sports, you can do them after 4 weeks. Non-contact sports, you can do them after 2 weeks. Driving depends on your visual acuity. Most of the patients can drive the following day after surgery. You'll come here for your first post-op visit and we'll give you the go-ahead that you can drive. There are a small percentage of patients that will tell them to wait for another day before they can go ahead and drive. Eye makeup after a week, and it's very important that when it comes to remove eye makeup, not to apply a lot of pressure on the eye, and be careful not to put any eye makeup remover products in your eye. You can go back to work 2 days after surgery. So we suggest the day of the operation, the following day that you'll come to clinic for your first post-op visit, and you go back to work on the 3rd day. Contraindications who can't go ahead with this type of procedures: patients who are under 18, and we prefer patients who are 21 plus, for the reason that between 18 to 21, from our experience and from studies, it shows that the vision would still be changing. It won't be stable at that age. So it's useless doing a refractive procedure when the vision would change again. Patients who weigh over 150 kilos, reason for this is that the machine has a lot of motors that control the movement, and if you weigh more than 150 kilos, we might be risking of damaging these motors and the machine won't work as it should be. As I mentioned before, the vision has to be stable for at least 12 months for the reason that if it will change, you would need a touch-up procedure. If you're on a medication such as steroids or immunosuppressants, please let us know any type of medication you are on. If you have any autoimmune diseases such as Crohn's disease, lupus, HIV, AIDS, anything related to hormones, please do let us know as well. These questions are in the questionnaires that we're going to give you to fill in before the test, but it's very important that you give us the whole picture of the situation. Diabetes is not a contraindication to go ahead with laser surgery and even implants, but we suggest that the diabetes has to be stable. We might ask you for a certificate from your doctor for us to make sure that your diabetes is under control. If you ever experience herpes simplex or herpes zoster, herpes in the eye, not on the lip, it's no problem. If you have experienced any type of keratitis, please let us know. We would know that these conditions happened for the reason that when we do a topography scan, we'll see a lot of scarring on your cornea. So this will be an indication for us that you might have experienced one of these conditions that I just mentioned. Patients who are not able to lie flat and look at the green light, is very important to lie flat and focus on the green light. Pregnancy and breastfeeding. We suggest 6 months after delivering a baby or 6 months after stopping breastfeeding to go ahead with these procedures, for the reason that in this period there will be a lot of prolactin in the body. Prolactin is a hormone related to change of vision. Patients who suspect that they have glaucoma is not a contraindication for laser, but it will not stop the symptoms of glaucoma. It's very important, it will not make it worse and it won't fix it as well. Patients who have high pressure in their eye, in that case, first we treat the high pressure and then we reassess if laser is possible to be performed. Any problems with your cornea and with your retina, we scan during the pre-laser these two structures. Infections, obviously if you have an infection you can't proceed, not even with the tests. And dry eye. Dry eye is a very common condition, and we have several machines that can indicate to us if there's enough tear film in the eye. If there's not enough tear film in the eye, there are several treatments that we can apply nowadays to promote more tear film production in the eye. Complications. One of the most common complications is dry eye. Nowadays dry eye is not that common since we're performing femtoLASIK and SMILE, but it used to be very common when we used to perform the surface ablation procedure. There's always a plan B for these conditions. Most of the time we'll prescribe the patient on lubricants to keep his eyes moist as much as possible, and also nowadays we have a facility of a laser that we apply around the eye, that this will stimulate the meibomian glands to produce more tear film. Also in this clinic, part of this clinic is a dry eye clinic, so we treat patients who have severe dry eye, even if they never had laser before. Over and under correction. Over and under correction is when the laser or the implant we implant in the eye will correct a little bit more or it will correct a little bit less. In these cases, there's also a plan B. What we'll do a touch-up correction with laser. Regression is a condition that used to be experienced when you used to perform the surface ablation procedure, the old procedure. We're not seeing regression anymore with femtoLASIK and with SMILE for the reason that this procedure is performed deep in the cornea, so there is no corneal nerves. In case of a regression, patients used to have to wear glasses again, but nowadays this is not common since we're using femtoLASIK and SMILE technology. Incomplete flaps for femto patients, as I mentioned before, there will be 21 seconds that a contact lens will touch the surface of your cornea. It's very important not to move at that particular time, because if this will happen, this contact lens will dislodge from your eye, so not to create any complications on your cornea, but we would need to stop the surgery. and then we repeat the surgery on a different date. There will be no harm done to the eye, but it will be an extra hassle for the patient that he will have to be rebooked. Slow healing for epithelium. This is also related to the old procedure. As I mentioned before, when I explained the surface ablation procedure, we used to scrape the front layer of the cornea. This used to take up to 5 days, but on some patients used to take longer for healing. It used to take even more than 10 days. So it was a hassle for the patient that they had to stay indoors. Thankfully, with the new technology, this is not an issue anymore. Corneal haze, glare and halos, these are very common, and this will happen with any type of procedure performed, being laser or implants. This is when you see a lot of light. You'll see like a glare and rings or a cross around lights. Most of the time this will heal with the drops that we will prescribe, with the antibiotics and with the steroids. For the first couple of days this will be experienced. Infections and inflammations. Infections and inflammations are very rare for the reason that we prescribe antibiotics and steroids after the surgery, but if this will happen, we would need to use either different drugs, drops, or else we would need to do a washout in the area where the laser was performed, which is a very minor procedure where we apply some saline on the laser area, on the lasered area. Last one, ectasia. Ectasia is when the eye will lose its sphericity after the laser procedure. Thankfully, nowadays we're not saying this anymore, for the reason that we have two machines that they will give us an indication if the patient will have ectasia post-surgery, yes or no. So this is a clear cut if the patient is eligible or not eligible for this type of surgery. If ectasia will happen, it is treated with a vitamin D drops and with a half-an-hour ultraviolet light on the surface of the cornea to stop the progression. 15% of patients who come to this clinic to have a refractive procedure are not eligible to go ahead with any type of surgery. 8% of these clients are patients who their vision is still changing, and we'll suggest them to wait for another year before we'll have another try. Another 7% are patients who are not eligible to do any type of refractive procedure, because if we do something for them, we might harm their eye. So in that case, better be safe than sorry. That's it from my end. I thank you for listening to this presentation. If you want to book for a pre-laser checkup, kindly call on 2247-2630. Now it's time for you to ask questions.